At some point in my career, it switched from how can I be successful to how can I make a difference. To be able to create something in New Jersey that really helps to provide a higher level of care for patients, that academic medical center health system model is an incredible opportunity to have impact. My name's Amy Murtha, and I'm the Dean of the Rutgers Robert Wood Johnson Medical School and the founding Dean of what will be the new Rutgers School of Medicine. By the time I was in my clinical rotations, I was pretty sure that I wanted to go to medical school. I applied to residency training programs and ended up matching at Duke, and I have to be honest, I wasn't sure that I thought I would fit in here. And it was completely exactly where I needed to be. The Department of OB/GYN at that time, led by Chuck Hammond, was a really incredible place. I had had no experience or exposure to research during medical school, and it wasn't until I was a third-year resident that I began to get a little bit more involved in research and really fell in love with it. And then at one point, several people left to the department, and I became the perinatal laboratory director. Actually, over the following couple of years, we developed the Duke Molecular Biology Techniques Workshop, which ultimately evolved into an internationally renowned molecular biology techniques training program. We had people come from across the world to join us. Being able to train folks in that molecular workshop, demystify what we do in the lab, make them not afraid of being in the lab, was really an incredible part of my career. I think the other thing that's really important to me is the people that I actually got to know and work with during my time at Duke. It was a really special time in the department and in the Division of Maternal-Fetal Medicine. And be part of that network of people who were here together for such a long time and appreciate the opportunity to continue to support each other is really just spectacular.
Welcome home, entering class of 2025!
When I went to Rutgers as the Dean of the Robert Johnson Med School, same approach to understand the culture and community and take time to listen and learn. I knew that there were plans in the works to merge the medical schools, the Robert Wood Johnson Medical School and the New Jersey Medical School. Both Rutgers medical schools, and what we've done tactically, which I think has been very different for that culture and that community, is to take time to listen and learn. It comes back to building relationships. So transformational change is wholly dependent on a foundation of trust. And being a new leader in the organization, I didn't have that. So I basically was required to build trust while we were moving the work forward. And we've made incredible progress. There's a lot to be proud of, and we're excited about the future. Your patients will remember you not just because of your medical expertise, but because of the kindness and humanity that you bring to them. Behind the scenes is clearly my husband, who has followed me back and forth across the country, has uprooted himself and our girls. He is the backbone of the family and keeps us afloat, and I couldn't have done what I've done without my husband, Rob. My girls, incredibly proud of them, and quite frankly, yeah, they've been amazing.